today. So my name is Meredith and I'm a physical therapist and center manager downstairs in Brooks Rehab, and this is...
I'm Courtney. I'm also downstairs in the physical therapy clinic that we have.
So today we're going to be doing low back pain 101. So we're going to try to start doing these quarterly, I think. So come up, teach you a little bit, and then we're going to do some exercises. But so the first topic we decided to go on was low back pain because of how prevalent it is. I wonder, can you guys hear me back there? Yeah? Okay. Because of how prevalent it is, it's about 50% of our caseload, I would say, in the clinic. So, will you go look at what I say?
Yes, I will.
Not right. So we decided it was a good topic to start with because it's very common. So the way that the format will be today is we're going to do, like, the first half is going to be us telling you, kind of following the format of the handout I just gave you. So giving you different informations about how and why low back pain happens. And then the second half of it will us be going through some exercises. So it's all going to be stuff you can do seated or laying down if you're comfortable with that. So we have mats, but there's stuff that can help you with mobility and stability for the low back. That'll be the second half, and then we'll do questions at the end. So,
yeah, all right. Fantastic. Okay, so I'm going to start here with just telling you guys a little bit about low back pain and the prevalence of how common it is, right? So I'm assuming everyone is here because you have some sort of pain or know somebody in your life that has low back pain. So believe it or not, 8 out of 10 adults will experience low back pain sometime in their life, right? That's a lot. That's 8 out of 10. That's 80% of our adult population gets low back pain. So that's a problem. What's the good news is 90% of people, adults, who have acute low back pain end up getting better. All right, so I say acute pain. When you hear the word acute, all we're saying is that it's simply a quick onset. It happened recently. It certainly can hurt, right? But we differentiate generally acute back pain from chronic back pain, right? Those are two different things. We treat them a little bit differently, okay? We consider chronic pain greater than 3 months, okay? So acute is a little bit shorter of a time frame, all right? So whether you have acute or chronic, the studies show that acute has better recovery, and we'll get into chronic pain probably at a different discussion because that gets down a little bit more of a complexity path there. So the good news is that back pain can resolve 90% of the time, and oftentimes, actually 90% of the time, low back pain is not caused by a serious condition. Okay, so maybe that means we slept funny the night before, or we moved funny lifting something up and then all of a sudden our back hurts. That is what we consider just a normal acute episode of low back pain, right? So the good news is that does heal, and it's usually not too serious, okay? To highlight that, we actually found a study. So I don't know how many people have had an experience with MRIs, but the study we found had 98 people who had no pain at all, right? So no back pain at all. 98 people went in and took an MRI, and their results showed that 70% of them had a disc issue at one single level. 70% of people who had no pain had a disc issue at one level. Kind of weird, right? But they're pain-free. They're okay. All right, so we'll get into that a little bit more. 30% of them had an issue with their discs at more than one level. So supposedly they should be in pain, right? So we're kind of going to explain a little bit more about that. And the way we're going to do that is we're going to look into the anatomy of the spine briefly, okay? So a lot of times we get wear and tear in our spine as we age. Part of that is normal, right? So what's happening with these people who went through the MRI and they have no pain, but supposedly their MRI is saying they have disc issues, right? Is possibly that their muscles are all functioning how they should. They're holding the bones in the spine where they need to be, and they're strong and stable. So to show you the back, this is the back from behind if you're looking at someone from behind. Okay, the red here, these are our bones in our back. They're called vertebrae, okay, and they stack one on top of the other. The bones here are supported by muscles, okay? So if we think of a ship and we think of the mast of a ship, okay, that's our bone column here, our spinal column. And then the muscles that attach to the spine are like the ropes that connect the mast to keep it upright, right? So we've got small muscles that will kind of jump from one vertebrae to the next, and then maybe move up a few levels, and they'll go all the way up to the neck, okay? So we have tiny little muscles in our back that will help us stabilize, and then we also have large muscles in our back. Maybe they don't necessarily run from level to level like that, but they run from maybe the hip all the way up to the head here. Okay, so they're both very important in their function. These little muscles help us stabilize, right? So if they're not doing their jobs, maybe the big muscles are taking over for them, they're turning off. The brain and the muscles in the little muscles in the back aren't talking as much, and the big muscles start to take over, okay? And that can cause pain, right? So if the mast is not being held equally, or there's some sort of imbalance or weakness in the ropes that are holding that mast upright, then we get pain, right? So that's where physical therapy can kind of come in and help with that. So if we're thinking about the low back, I'm sure you guys talk about a lot, or hear a lot about the core when we're talking about low back and low back pain. So on the topic of muscles and the low back, I want to explain a little bit about what the core is, okay? Because I think a lot of times people will assume it's our six-pack muscle, which is a great muscle looks-wise, but we don't love that muscle functionally, okay? So if you picture a room, okay, ceiling, floor, walls, think about the walls are a muscle called our transverse abdominis, okay? It's our corset muscle, and we'll work on engaging that with everyone today. So the walls are our corset muscle. It wraps all the way around our spine to our belly button. Okay. The ceiling of we're going to take questions at the end. Is that okay? Okay, yeah. Awesome. We'll get back to you. Just remember it. Okay. So the core, right, is our walls. Our corset muscle here is called our transverse abdominis. The ceiling of our core is our diaphragm, which is our breathing muscle, right? And then the floor is our pelvic floor. So the muscles that help us stop the flow of urination or gas or something like that, okay? So we need to make sure all of these muscles are functioning when they need to, how they need to with other muscles, and a lot of times focusing on these types of muscle activities can reduce low back pain, okay? So with that being said, how do we know if we have low back pain? That's probably pretty obvious, right? We're in pain, but it feels different to everybody, okay? So there's no right or wrong. It's very, very subjective. It might feel pain in your bottom or in your hips. You might feel pain directly in the middle of your back, one side more than the other. It might feel tight or achy or dull, sharp, lots of different ways to feel pain and lots of different reasons for that. But ultimately what we're looking at here is getting that spine nice and stable via the muscles that are small in this area that connects vertebrae to vertebrae, and getting them working well with the other muscles in the spine that are a bit more global.
Okay, so before we go to the next section, I guess I wanted to highlight, so we're kind of, this is the low back pain 101, so we could probably build on this again in a later series, but the muscles that get neglected, these small stabilizing muscles, are ones that you can't just go to a machine out in the gym and exercise. They're isolated by very small, fine motions, and this is a lot of times why they don't get worked as well as we want them to, because, like, for example, one of the big muscles is your latissimus dorsi. So like the lat pull down out there works that big muscle, but there aren't machines that really target those small stabilizing muscles. So we will go into that when we get to the exercise part, but that's kind of part of why if these muscles stop turning on like they're supposed to, it's hard to get them to reignite without someone that really knows how to target it and how to train it. So that's where we come in. So before I go into more of the causes of low back pain, I just do want to highlight, so if you look at your handout, there are some times on the bottom where you want to contact your healthcare provider. So these, I just kind of want to highlight them. So if you're in any of these categories, this would be when you do want to seek additional medical care. So if your back pain is a result of a fall or an accident, you are 70 years older or older, and it's a new onset of back pain. So not something you've been dealing with and it just keeps coming, something that's brand new. Pain that doesn't go away even at night or when laying down. So if no positions make your pain any better, it doesn't change positionally, that's kind of a red flag too. So you want to follow up with a healthcare provider. Weakness in one or both legs, any problems with bowel or bladder or sexual function, an unexplained fever, rapid weight loss without trying to do that. And then if you have a history of cancer, or if it's not improving or changing at all within 4 weeks and you are actively trying to improve it. So those are all things that could mean something else. It doesn't mean they do, but if you have those situations, you do want to go to your primary care and kind of check it out. So in terms of general causes of low back pain, the majority of the time it's what we consider non-specific low back pain. So it's not like there's one problem like right here and that's the cause of all of the pain. It's over time, most likely due to movement patterns and things like that that have compensated for maybe an injury long ago, but it's not something one specific thing. And so what happens is there's normally not enough mobility or stability. That's kind of like the two categories. Okay, I'm getting hot. Just rewrite this here. There's normally not enough mobility or stability. So if we're looking at the spine, so kind of what happens is there's almost, so in most people, as Courtney talked about in the imaging studies, you would find something on an MRI, right? But the people that don't have pain still have these issues, and how does that happen? It's because they don't have as much stress on those structures as other people have. So if you're having pain, most likely there's too much stress on the area where there is some sort of issue or degeneration that can be totally normal, but there's a lot more stress on that area. And so the way you try to decrease that stress is you want to get enough mobility and stability. So that's kind of how we're going to break up our exercises, but just to explain it a little bit more. So in the spine here, so these are all the lumbar vertebrae. So if you're having low back pain, it's coming from one of these guys down here. And so they're supposed to move, spine's a little bit stiff, honestly, but it's supposed to move this way, and then side to side. They're not red inside your back either, they're all white. But so it's supposed to move all 4 directions, and if it doesn't move in any of those directions, what happens is it puts increased stress on the joints. And as you can see, there's a lot of different joints really, but the nerves come out the sides here, and so like the sciatic nerve will come out and originate from some of these. I know that's a common problem. So if there's not as much space for the nerve to come out, it can get pinched more easily. And if there's not as much mobility between the joints, the nerve is going to get pinched more easily. So essentially we're trying to create more wiggle room by working on mobility. So we're trying to give it as much space as possible before you get to that threshold of pain or irritation level. And so we'll go over exercises for that. And then the stability component goes back to the muscles that Courtney was talking about. So all these smaller segmental muscles that go a couple levels up and down, if they're not there, what happens is, again, increased pressure on the joints. And so really the goal is to decrease the pressure. So for the decreased stability, we're really working on those core muscles, the pelvic floor, the transverse abdominis, the diaphragm, and we'll kind of go through how to activate all of those, but that's really the biggest focus, to take the stress off of this area, and some degeneration and things like that will exist. So before we go into the actual exercises, we want to touch on just 2 other things, and this is under the what I can do section there. So icing, if you're having, these are just some other things that can help. So if you're having acute back pain, like you did something, maybe you were moving or lifted something you shouldn't have and it's really bothering you that day, so ice is the best option at that time, because it's going to help with the inflammation and help take away some of that pain. If it's more of a long-term pain you had and the muscles are very sore, heat would be potentially a better option, so those will always help you. And then posture is another thing. So depending on how you're sitting and your posture puts more or less stress on the low back. So I think that's actually going to be our next talk, is like what's really important in posture and muscles and exercises for that. But just knowing that, the more you're sitting with good posture, if you think about like you're like Pinocchio and someone's pulling you up, less stress. You'll be putting stresses on the areas that are designed to take stress as opposed to ones that are not. So, all right, you guys ready to do some exercises? Let's do it. All right.
Can I ask a question first?
Yeah.
What about, I did physical therapy for 2 months for my low back pain.
Yeah.
And what they focused and told me was the band that you were talking about in the core. They said that there is one attached to your hip and then go down here that goes all the way around. And they were working on getting that band of muscle more tight and firm than anything. So I don't know if you agree with
Yeah,
that.
I think that's. I think that would be the obliques. I'm assuming. So there's four
The one that's attached to the hips.
A
and
lot of
then-
them attached to it.
Yeah,
That's
there's
the
about-
But
trick.
they said it goes around this way on your hip.
Yeah, so that's the same muscle. It attaches to your hip bone,
Same.
so it goes the whole way around and attaches to your low back, but it does attach to the hip bones here as well. Yep. There is like
So it's not two sets of muscle, like you have to work here, then you have to work down.
well, so we simplified it a little bit, maybe too much. So the most superficial level, like the ones at the farthest out, is like the six pack, the rectus abdominis is on the outside. Underneath that is the internal and external obliques. So those muscles run like up and down like this, and they do attach to the hip muscles. So they are activated through different types of motions, like more side bending type exercises. I'm not sure if that's what you were doing, but they do also stabilize. Then there's the transverse abdominis, which is the deepest level that the corset type of muscle. So they're all important for sure. If we're thinking about what typically doesn't turn on with people with low back pain, it's that deepest level. Some of those other levels kind of get targeted in crunches and things like that, so they don't have as much of a problem turning on. But
So all the muscles starting up here that run all the way down to the hips in the front are interrelated to the back
The core.
Yes,
yeah,
ma'am.
absolutely.
pain
Yeah.
and
Yeah.
support.
Yeah.
Exactly.
Oh, absolutely. Yeah. It's
Okay.
that deepest layer that I was mentioning, but you're absolutely right. There are multiple layers of the core of our abdominal muscles. And you know what's interesting to me, and I don't know how long you've had back pain and all of that. I know everyone's different, but I will say there are studies out there that show like sometimes it takes like 4 to 6 weeks just to get a specific muscle to turn on. So we think about a bicep curl. That's pretty straightforward, right? We're turning our bicep on to bend our arm, but it's not as straightforward when we have back pain, especially chronic back pain, because, like I said, and this gets a little bit more into the nitty gritty of things, but the brain and the muscle aren't, if you will, aren't talking as much when we're in pain for so long. That pain inhibits the muscle's function, and the muscle's like, I don't need to do anything. Nothing's telling me to do anything, and I'm in pain, so I'm not going to function like I'm supposed to. So that can be part of it, is just training these muscles, and it can certainly be tedious and difficult, but it can be very doable, and practice honestly makes perfect. So, and we'll definitely address any more questions that you have, okay?
Thank you.
Yeah.
Awesome.
But for sure too, if it starts with some sort of like traumatic incident, like like a car accident or something like that, that kind of affects the muscle's ability to turn on from the get-go, and then you have almost more of an uphill battle. So there's lots of different factors, and we'll get to it too, but we are available like separately to answer really personalized questions too, but we can at the end, but also like in person look at how you're moving. So we're gonna do our exercise component now. Does anyone want to do their exercises? We have 2 options, 2 variations. We're gonna do options for sitting in the chair and then options for laying on a yoga mat. We're going to demonstrate both because we're doing Facebook Live. I don't know if people are watching it or not, honestly, but so that they can try that. But if someone wants a yoga mat, we could bring you one around if you'd rather lay. Yeah.
Yoga mat? Yoga mat? Yep.
Well, I don't need a mat, I'm just gonna do mine in the chair.
Okay. Oh yeah. So sorry, we were just wondering if anyone wanted to lay on the ground to do it. We'll show you all of
Get
them.
down there, I can't get up.
Yep. That's what we figured. That's why we have chair options for all of them.
Yep. Sure.
Yep. So we're going to demonstrate both just in case people want both, but you guys, we want you to participate. It's mandatory to participate, actually.
Mandatory, guys. All right.
Unless it's, you hate it, then you can stop.
I'm going to run us through, like Meredith talked about, mobility, movement, and stability, stabilization, right? I'm going to run us through mobility, okay? Moving. We're going to get things moving. We're going to wake things up a little bit, okay? Certainly can stay in the chairs the entire time, okay? So there is not a handout for this, but it'll be accessible via Facebook Live. So if you need it, it's there. And then let's go ahead and just say, we're not going to worry about sets and reps and numbers. I want everyone to just feel what is happening in their bodies, okay? So we're going to bring some body awareness to these exercises and probably just do a few rounds, maybe 5 reps of each or so, and then we'll walk around while you guys try it. And if you have questions, we'll kind of help you out, and then we'll come back and do another exercise, okay?
And this will be on Facebook Live?
Yes,
This
so
is
it's on it now, and then it'll be
yeah.
recorded on the Wise page, so you can access it later. And then if anyone is watching it live or later, so we're going to demonstrate, and then you guys practice at home, and we're going to walk around and see how
Cool.
these ladies do.
Ooh, all right.
Test, okay?
So, instructions first here. Like I talked about the core, we're going to start with the diaphragm, okay? So our breathing muscle, it's truly a breathing muscle. So this is called 360-degree breathing. I'm going to show you it in sitting. So we're going to sit with tall posture, okay? So nice and tall, like Meredith said, we've got a Pinocchio string up through the top of our head. Meredith's going to lay on her back with her knees bent. Yes. Okay. So what I want everyone to do is take their hands, open them nice and wide, and place them on the sides of your rib cage. I want the thumb towards the back of the rib cage. Yep, and so what you want to do is you want to take a big deep breath in through your nose and exhale through your mouth. And as you do that, that body awareness, I want you guys to feel the hands move, right? So the thumb should be pressed outward by the rib cage. The rib cage is expanding all the way around, 360 degrees. We're getting a little bit of movement in that rib cage, okay? So let's take 5 big deep breaths here. Just in through the nose. Feel the thumbs press back. Feel the ribs press into your hand, and then exhale. Okay. Our breathing patterns can even be affected by low back pain if we've had it for quite some time. So getting our breathing rhythm is important. Working the ceiling of our core, okay?
On the back is important. 2 to 1. Whatever.
Yes. So with this movement, you'll feel a little more movement in the front in your fingers than your thumbs, right? There's actually a 2 to 1 ratio. It moves twice as much toward the front as it does the back. But we do want those thumbs moving, okay? So make sure you feel those thumbs pressing out by the rib cage, okay?
Yeah, so typically we all end up like short breathing, and the front part is the only part that moves. Does everyone feel their thumbs moving in the back? Yeah. I don't know if this is one we need to come around and check necessarily.
Everybody feel pretty good? Pat, can you feel everything back here? Yep. Just working on feeling those thumbs move back and the whole rib cage just expanding, okay? A couple of breaths here, don't get lightheaded about it. And then we're gonna move into the next one. I think you guys are all pretty confident on that one. You guys all looked awesome. So the next one we're gonna do, again, we're moving. So I want you to take one knee and try to bring it up towards your chest. It's called single knee to chest. Grab it around the knee. Yeah, right. For some people, right? Yeah. Hey, and so just do what you can, nice and gentle, either the front or the back of the knee. So Meredith is again grabbing for her behind the knee, bringing it up towards her chest comfortably. Okay. Some breaths here, maybe a 2 to 5 second hold. Nothing crazy, and we're just getting those hips moving. And then switch. The importance here is that we're getting moving. We're getting the hips good blood flow. We're getting the joints nutrition via movement. Okay, this is all really good stuff. As simple as this seems, is wonderful stuff for the back. Stretching the hips, so we'll do a few more on each side. Okay. Any questions? Holler if you guys have questions at this point. You guys all look awesome. It shouldn't be painful. Should not be going into tons of pain here. So just nice and easy. Okay. We'll do one more on our other side here. Okay. Everyone looks great. So knees back down, feet flat on the ground. We're gonna go for another one. Again, blood flow and movement. So we're gonna keep our knees together. Again, Meredith's on the ground, so her knees are together. She's in what's called a hook lying position, just with her knees bent and her feet flat.
Yeah, so if you guys, sorry to interrupt you, Courtney, but if you guys want to do these later at home, and try, you can do this laying on your bed, so you don't have to get on the ground. So all of these you could try if you want to try it laying down, also in bed. Percent side.
Okay, so again, always tall posture. We're never going to tell you guys to slump. Well, slump test. Okay, so you're going to wiggle your knees together like a windshield wiper, back and forth, right? Side to side here. A little bit of rotation in the hips. Meredith's going to get a little bit more into her lumbar spine, her low back, because she's on the ground and her hips can move a little further. Okay, this is still very beneficial. So we'll go, let's say 10 times back and forth here. Just wobble those knees left and right. Again, it shouldn't be painful. So if it hurts me to go all the way out here, I'm gonna stop before that point and do little wiggles, okay? Just warming up the tissue there. That's right. Good. We're gonna go 2 more here, all right? So go ahead and rest. Everybody rest those knees. So Meredith, I'm gonna have you change positions and ask you to get into a tabletop or on your hands and your knees. So we're gonna stay sitting here, but another effective way to do this, these 2 next exercises, it's how Meredith is right here on hands and knees. So the first one we're gonna do is called cat-cow. If you guys have ever taken yoga, you might know exactly what that is, okay? So what you're gonna do is we can put our hands on our legs, our thighs, and we're gonna curl our spine back, okay? So we're trying to press our spine straight back into the chair, tuck our head down, and kind of slump that pelvis, roll back onto your tailbone, and then softly and slowly arch your back, look up. Big breaths here, yeah. And then slowly curl that spine back down, pull that pelvis and that head towards each other, and then again, rock back into that extension. This is going to be one of those exercises again. You let your pain be your guide here, okay? If it hurts to go too far, don't go that far. That's okay. Sometimes we have preferences on whether we want to bend forward or bend backwards, and that's okay. All right. Good. Let's do 3 more. Just good, you guys. I don't know what they need us for. Beautiful. Okay. So this is a good one again, just sitting down, perfectly easy and very good for spinal hygiene, right? So we brush our teeth all the time, we gotta take care of our back and our bones, right? Okay, so I've got one more for you guys. And then I'm gonna hand it over to Meredith so she can teach you a little bit about stability. So, child's pose, another yoga move, which is wonderful for the back. For us, we're gonna go wide knees. Meredith is also gonna be in the similar position and she's gonna drop her hips back. We're going to lean forward, roll our hands down towards, roll our hands down towards the floor, get a nice curl in our spine, feel our hips part and stretch. Good, and then slowly come back up. This stuff isn't fast. We're being very intentional, feeling where maybe it's tight, maybe it feels good here and there. Back down. Good. And so Meredith can rest in that position. She can go back and forth, in and out. Likewise, we can also stay at the bottom of this. Let's do 2 more here. Okay, all the way down as you can comfortably. Yep. Perfect. And we can even choose to walk our hands down one leg instead for a little bit more of an opposite side stretch, right? And then maybe down the other leg, maybe one side feels tighter, that's okay. Just work on the breath, breathing through it, coming back up slowly. Yep. Good. You guys look awesome. All right. We have moved. Now we are going to listen to what Meredith has to teach us about some stability work. Alrighty?
Yeah, I'm doing it. Start with one that's kind of, yeah, I can just bring them over. Okay, so first we're going to talk about activating the transverse abdominis. So that's that deep level of the core, that the corset muscle that we were talking about. So if you've gone to physical therapy for your back before, they probably have had you try to turn that muscle on. Lots of different ways, and everyone uses different cues. So what I want you to try to do before I tell you a position or anything is to try to think about blowing air out of a straw. So you have like a drinking straw in your mouth, and I want you to try to blow air out of it. Kind of hard to mask, huh? Like blowing hot air in your face. But when you do that, you should feel kind of like a deep pulling in happen. So that is activating your transverse abdominis. So when you don't have to blow air out every time, but if you do that, you should be able to feel it, and then we're trying to replicate that feeling. So what you're trying to do is pull your belly button in towards your spine. It's kind of the active motion. So sitting here, if you want to think about, so you're in this good posture, I want everyone to feel like the bottom part of their ribs. See if you like kind of lean back, you can feel them stick out. We want to do the opposite of that. So you want to tuck those ribs down. So it's almost like you kind of feel like you're leaning forward, but that's going to get your core in a good position to engage. Now from there, and Courtney's doing the same thing in that position down there. So next thing is now you want to think about pulling your belly button in towards your spine. So you're pulling it in. If you want to try the blow air out technique just so you can see if you're doing it right, that's the same thing. So you want to keep that. It's a lot to think about at once, it really is. And it can be tiring for such smaller muscles. So for this one, we're really trying to hold. So now we're trying to create more stability, so it's muscle activation, not just movements. So you're pulling in and holding. I would try to hold for a couple of seconds. Do you guys feel it or not sure?
Oh, yeah.
Oh, yeah.
Okay, cool. Good. Okay, holding it, and then you can relax. So for me, I find it helpful if you find like your hip bones, the pointy part on the front, and then you go just a little bit in the middle of that. When you pull those muscles in, you should feel a tightening there. Like just in, so hip pointy part of the bones, pull it, go just a little bit towards the middle. And so when you pull those muscles in, you should feel at least a little bit of tensing in there. So that's how one of the ways you can know if you're doing it correctly. So if you do the blowout through the straw, you'll also feel it there. So let's just try a couple rounds of that. So you're gonna pull your belly button in, hold for around 3 seconds or so, and then relax. You really become an expert when you can do this and breathe at the same time. That's like a whole nother level of challenge. But anybody wants to come feel and see, or they just a couple of things.
This is when they did physical therapy.
Yeah.
Yes. And this is kind of the foundation for therapy a lot of times for back pain. 'Cause this is we got to build from the ground up. So we got to get these muscles turning on, and then we can build on that. But this is kind of the basis of most of the exercises.
Yeah, they have the bed over and up against where the pool is.
Yes.
I'll come in here and do the weights,
Yeah.
and then I'll lay on that bed and do some of the,
Yeah.
core, this kind of stuff.
Yeah.
Which looks weird to people who are just in there for
Oh,
weights.
it
but
doesn't matter.
I don't care.
Yeah, no. Okay, so now let's move on to the next one here. So this one is going to be, it's called, let's see. I'm going to bring a band around to you guys in case you want to try it with a band. Here, let's give everyone one. Yeah. So this is going to be working on those small segmental muscles that we were talking about. And so the way you get those turning on is to try to move really as slowly as possible through those little sections. So you're gonna, I guess I should have a band.
Those are the little ones that are on your spine. You were
Yes,
telling me about.
exactly.
I didn't know we had those.
Yes, and like most people don't even know they exist. So I'm gonna talk through the one that you guys have. So you don't have to use a band. The resistance just kind of gives you some feedback. So you're gonna put it under your feet. Courtney's gonna be doing a completely different exercise, so I'm gonna talk us through it first and then I'll talk about it. So feet on the band, both feet. And then you're gonna cross your arms across your chest. Yep, perfect. All right, so now you're gonna kind of let the resistance pull you down. So you're trying to curl down one level at a time, like one of those little bones at a time. And you're curling like you're making yourself into like a turtle shell almost. So you're trying to roll your shoulders towards your hips. So you're going almost as slowly as possible and really rounding through the low back until you get all the way to the bottom. And then once you get all the way down, you're going to start rolling back up one level at a time again, but starting from the low back. So slowly, and this is where more of the resistance is on the way up. So it's almost like someone's squishing you and like pushing you in half is the motion you're trying to do. So you feel like is her resistance over here? curling down.
How far would you say down?
Try to get your elbows to your hips. If your arms are crossed, that's like the maximum it'll be. Doesn't quite go to the.
Nice and high.
Yeah, you want to keep arms on your shoulders, hands on your shoulders. Try to get your elbows towards your hips is the motion. And then on the way out, you're starting motion from the low back and rolling up. So I'll let you ladies practice that. I'm just going to kind of talk through the other option down here. So Courtney is going to do the same idea in terms of one level at a time. But so she's going to push up first, like into a bridge. So you don't have to just regular. So up into a bridge. And so then once she's there, she's trying to roll down from her spine, starting at the top, one level at a time. So we're really trying to go super slow through each level of the low back, especially, well, each level of the back, but especially when it gets to that low back segment. So what can happen is it gets really choppy. Will you show us like an uncontrolled version of it? So it's kind of like what we see. It's very exaggerated, but that was good acting. That's kind of what we see in the clinic a lot, though, because these segments have started to move as one. It's like 5 bones, but now they think they're only 1 bone, and they move together. So when we try to articulate them like that, they have a really hard time. But then going one level at a time super slow, at first it's very hard. Just same like this, it might not feel like you're doing it. The more you practice it, the more they'll move individually, and you'll get more of those muscles stabilizing through there. Does everyone feel like they could feel it with their bands? Like in the back, the low back especially? Okay. So this could be if you don't have a band at home. You really don't have to use a band even. You could do it just as kind of a stretch more than anything. You're still going to be using the muscles even without a band. So if you don't have one at home, it's still a good exercise.
I have one of those bands that have 4 on it. Has a central disc, and then there's 2 here and then 2 there.
Oh,
Is that possible to use?
you could probably step on the center disc and just use 2 of them.
Okay, just put
That's
the
what I
disc
would
there
do.
on the floor and let the 2
Yeah.
down there and then do it. Okay.
Yeah, I would do that.
Yeah, that's a great idea.
Couldn't figure
Sounds
that. I
nice.
wouldn't have been able to figure that out.
Okay, so next we're going to do clams, which maybe you've heard of if you've gone to therapy too. So this is a muscle, an exercise that is for your deep butt muscles essentially. So they help stabilize the low back. So they're typically done on your side, but we're going to modify them here for sitting. So it's for the external rotation, like if you've heard of your piriformis muscle, that kind of stuff, that's what we're using. So in sitting, you're going to bring your feet all the way together. And so we're sitting up tall, and then think about those ribs again. You want to keep them tucked so the core is feeling good. And then you're going to rotate, and rotate one knee at a time out. And so what you should start to feel is a little bit, you'll feel a stretch probably in here, but you should feel some activation in the butt muscles on that side. And then you're going to go out. So you really want to try to get it as wide as you can. So this does kind of get a stretch too, but you're getting activation in those muscles there. So we'll keep going in our seat, but for Courtney, she's got perfect form here, so you want to keep your hips stacked like she has. Knees are bent, and you're opening and closing your knees. So it's not about how much motion you get, it's keeping the hips stable. So yeah, so that's what we're avoiding. Rocking your hip back. So you want to keep them stacked, just like that. Yep. So we're alternating. You guys feel it in the back of the muscles?
That looks like it'd be harder than it works.
It is. It's much
getting
harder
tiring.
here.
Because I've tried that, and
Yep.
it's not easy.
Yeah, again, so maybe in bed at home. That's a more effective exercise for sure. If you do it in sitting and you have like a looped band, you could also do it that way. So if you had, this doesn't necessarily work for it, but if you had resistance, you could rotate one out like this. So I kind of, I
Like
just
that,
folded them and then
they're not this kind of band, they're just a regular band.
Yeah.
With a medium,
even do like this.
much and less resistance.
Uh-huh.
The bands like that you put up at that.
Yeah, that would work. Yeah.
I've been trying to do it stuff at home.
Yeah, so then if you cross them and hold them like that, that should work.
Yeah.
And then rotate one away. Yeah, you should feel more activation in the muscles doing it this way.
That might be easier.
Right, like that. You get a little bit of an arm workout with it. And then feet together, and then rotate. Yeah. So start with your, yeah, exactly, perfect. Oops, one at a time. Should feel a little more activation that way.
Yeah. There's a lot more resistance. You can feel it, you know.
Doing something?
Yeah, doing something instead of just opening your leg.
Yep, woo. True. Okay, so this is our last exercise, potentially the most confusing of them. So we're going to talk through pelvic floor activation now. So like Courtney talked about, this is the floor of the room example. So really, if the pelvic floor isn't turning on and you do everything else perfectly, you're still not going to have success, because that is the bottom part of the Coke can. You know, like you can't carry any liquid well without that. So what you're going to try to do is, some people consider it a Kegel. Those exercises don't get quite as many muscles turning on, so you're going to try to squeeze like you're stopping the flow of gas. So like you ate something you shouldn't have, and you're trying to stop the flow of gas. And so while you're doing that, there's not really a cue for me to show you, but you're going to just try to do it in your chair. So you're going to squeeze, and what you should feel is like a pulling up of the muscles underneath your bottom. So when those muscles are weaker, a lot of times you'll be able to see motion, maybe you're squeezing your butt muscles, stuff like that. That's totally fine. Those muscles are trying to help. You're going to squeeze like you're trying to stop the flow of urine or gas, is how to turn them on. And then you want to hold it. So most times people have a hard time holding that. So the goal would be like 10 seconds, I would say. But at first that's probably not possible. You're going to try to hold it, and it'll kind of ease off as you go, because the muscles just don't have the endurance. But this is a good one to do. You can really, those muscles we want turning on while you do almost any kind of exercise, but it's another one that kind of stops turning on with low back pain, sometimes with age, sometimes with having a child, but we should be able to get them to turn on. So the more practice you do, the better. So we're just pulling it up. Yeah, I don't have any better cues for that part. But
I don't think so, yeah.
okay. So you want to...
All right, guys. So that is a wrap on exercises and our little talk about back pain, and hopefully you guys gathered something of help or importance for you and your back, and maybe trying some of these exercises. Feel free, we're downstairs, literally I think under this room, because we hear you guys always smashing weights on the ground and people ask us if it's a bowling alley. So we're downstairs in the Winston YMCA. Feel free to stop by the clinic for a free injury screen. They're 15-minute small appointment times where we can kind of just go through a rapid assessment of what's going on with you, and just try to give you a little bit more direction, whether it's go to your primary care provider, come to physical therapy, modify this or that. Okay, we're here to help you guys. We're super happy that you guys were able to join us today, and super happy to take any questions as well. Of course.
Of course.
Yes.
Yeah, thanks.
Yeah, of course.
I think the most difficult part is when you get older to do this without motivation with a group.
Yeah.
When you're in a group, it's just like everybody's doing it together, or you
Yeah.
feel more.
Right.
It's hard to get motivated because I live by myself, and it's hard to get motivated.